done here is taken patients with orbital exoneration, so they've had the eye, the socket removed, and we're able to scan their face, get a good representation of the topography of the face, and then from that translate it to some digital data that we can then send to a 3D printer. And because of that, we were able to reduce the cost of an orbital prosthesis from about $15,000 to about $500. So this is made out of a new material that we've developed called SIBS, and we've reinforced this with nanoparticles in order to make it more resistant to moisture degradation, UV degradation, things like that, and also to transfer the color of the patient's skin tone, which is a unique capability, something that's really novel. And we're able to capture the patient's skin tone very, very well using these nanoparticles. I hope we can gear up and have this ready within a year or so.
So what I developed and I patented is this optic attachment to be magnetically attached to the smartphone like this. So it aligns the LED light from the smartphone to the camera exit, which is the method to see through the pupil. This way you can assess the fundus of the eye. And if you would like, I give you a demonstration. So this is a false eye made of plastic with the characteristics of a normal eye. So you just do like this. Okay, this is the optic nerve. These are the vessels, as you can see. And there is an automatic compensation for the refractive error of the patient, exploiting the autofocusing system of the smartphones. And so this is suitable for dilated and also in this case undilated eyes. The idea is to develop screening programs so you can easily assess, for example, the optic nerve of glaucoma or diabetic retinopathy, hypertensive retinopathy, and so on. It's also amazing for children because, you know, children are really familiar with the devices, they love it, and in my personal practice, when I have a terrible child, I take this from my pocket and wow, they should look at this and I can catch the data I need. So it's very nice for children and for screening purposes. We are still clearing the CE certification and the FDA certification, so it will be probably available in the next month. Before in Italy and Europe and then in the US.
I've been doing some work on visual field screening using an iPad, and we've been especially testing it in Nepal. The visual field screening is a test of peripheral vision, and we've been mainly looking at glaucoma and diabetic retinopathy, which are very common in Nepal. And it's very difficult for people to get access to health care in Nepal because of the altitude and such. So we've been doing this test. We have over 400 people that we've tested, about 200 glaucoma, about 40 diabetic retinopathy, and about 200 normals to get the performance characteristics. It's done on an iPad where there is a fixation point that is available, and one presses the button and then targets appear, and they press on the iPad to indicate when they see the target. And the results so far have been very promising. It correlates quite well with standard clinical tests. The correlation, a perfect correlation would be 1, and no correlation at all would be 0. This correlates at about 0.8, which is outstanding because it's a screening test and it's very portable. It's a free app right now. It's called Visual Fields Easy, so anyone that wishes to use it can do so. There are some difficulties with it, and I've had a lot of experience with visual field screening tests, so there are some obvious things that we will be doing to make the test more efficient, reduce the time, and make it more effective.